once you can tolerate hard blasting, you're ready to begin using the nugget ends. And we're going to use the blunt end of the nugget to begin trying to break up some chunks. And this lateral thigh area, you can see that you can hold the blaster and go along this IT band here and break up some adhesions by doing what's called a poke and a wiggle. Okay, so by poking and wiggling along this line, it's going to help me break up adhesions and get a nicer contouring of the muscle of the lateral leg. You'll see that you get the little indents in your skin, and you know then if you get the small little indents and they might turn into little bruises, that's the pressure required to get effective treatment of those fascial adhesions. So I'm going to poke in and wiggle. Now the technique here is not to slide on the skin back and forth, but to poke in and then wiggle. So really I'm massaging the deeper layers of fascia. Poke in and wiggle. And it's normal that you feel a little bit of pain there, but I want you to try to stay between 2 and 4 on the pain scale of 0 to 10. So this shouldn't be extremely painful for you. It shouldn't make you grimace. It shouldn't make you contract your muscles. But you can go up in a line here and poke and wiggle along that line. Staying under a 5 for sure on that 0 to 10 pain scale. Another area I've done a lot of poke and wiggle is around the knee. You can get chunks of knee fat here, particularly in this medial surface of the knee, and it's another great place. You can support your tissue with your other hand and go in and poke and wiggle around this area. And that's been real effective for me to work around the knees and be able to reduce some of the adhesions that really exaggerate the appearance of cellulite. So you can work it all around the joint with the poke and wiggle. After you've worked poke and wiggle in the areas that are chunky and you feel like you've broken up those chunks, take the blaster again. This acts to sort of flush through the tissues and help you mobilize some of the junk and the adhesions that you've mobilized. So you're going to blast again over the areas that you've poked and wiggled on. Activate the muscles with good muscle contractions, and then you'll be good to go. Good luck.